Dr. Polohi, as DG of NAFDAC, tried to do something like this, but he did it halfway. It is very, very instructive that the DG of NAFDAC would say there's an urgent need to create a commission for herbal medicine. I stand with the professor of pharmacology 100%. This is because it is the right person that has been approved for the rightful position. Why do I say this? Nigeria has a lot to gain in terms of its earnings from herbal medicine. And it's good to appoint a person that is well exposed in terms of knowing what his or her work would encompass. This new DG, coming from outside, knows the thinking of the entire world about herbal medicine, knows the thinking of WHO about herbal medicine. And having taken over the responsibility, her first statement is she pledged loyalty to work with the herbal practitioners. And she did not only say that, she has gone ahead again to propose the formation of a commission. Why is a commission important? The commission would mean that herbal medicine has been fully identified to stay on its own as a commission. It will recruit its own staff, will have their functions will be well spelled out. Their collaboratory functions also with NAFDAC in terms of regulatory activities. And they will become a corporate organization that can be sued and they can sue. And with this will increase the scope of herbal medical practice. And that will go a long way to broaden the scope of practitioners now. And it will make the world realize that Nigeria is very, very serious in the area of herbal medicine. Not only that, all the hanging fruits from herbal medicine, it will quickly bring it together and harness the benefit to the country in terms of its contribution to the GDP, now that Nigeria is looking for other means of getting revenue. The herbal medicine area has a huge, very, very huge, I can say. As I speak with you, I am not going to be selfish. The work I'm doing and the work which other practitioners are doing is enough to diversify the economy of this country. I give you an example. Some visiting American scientists visited me here and specifically asked for what anti-cancer products do I have. I gave them 5. When they went back to the US to show their seriousness, they went to the Texas State University, where undergraduates, PhD, and so on, they gave them the product and they started to analyze them. The first analysis they did with my product, they analyzed for the cancer of the colon. While the experiment was going on, while they were monitoring it, they saw that the same product can cure cancer of the lungs. And they decided to do it pari passu at the same time. What did they find? Both products, one product had over 89% effectiveness in both cancers. Is that not a joyful noise? That Nigerian product, herbal product, could elucidate therapeutic effects on colon and lung cancer. And by extension, the one on lungs today is used to cure asthma. Asthma cannot be reversed anywhere in the world. Even if we carry that asthma aspect for the entire world and say we will treat asthma cases in the entire world, do you know what that will mean to our economy? Do you know what earnings that will come into Nigeria? Do you know Nigeria will be well represented in the Committee of Nations and respected, rather than people talking of incantation, adducing different fake beliefs towards herbal medicine? Whereas WHO has gone the entire world to find out how do people live when they are sick, and they discovered that 85%, over 80% of the world population depended on their folklore medicine. on their herbal and complementary and alternative medicine. 80%. And WHO was convinced that we all clamp hand and join her and urge government not to waste time in creating this department, which the commission, which will popularize herbal medicine, widen the research which is being done now. Government can give grants, research can be in various areas, and then Nigerian medicines can come on board, urgently come on board. And once it comes on board, it will be able to compete with other medicine anywhere in the world. And as I sit down here, I can say that without fear, that Nigerian medicine, I have just told you the one taken to the U.S., the U.S. authorities accepted it. It was presented to a gathering of over 18 scientists in America. And the scientists all unanimously said it was a lead discovery. A lead discovery. That is my SAPFA 6, which you can Google on the internet. Then the one we sent for the Indian Journal of Medical Research, the one for malaria SAPMA, the Indian Journal of Medical Research has published it. And the journal is 141 years old. And by that publication,
modern day medicine, and especially those pharmacies that may not want to be in line.
Why are we talking of modern day medicine? WHO is the guardians of the health in the entire world. Either it poses to modern medicine or not, medicine started first with herbal medicine. What do I mean? Aspirin came from miado plant. And in an attempt to mass produce aspirin, the structure of aspirin was studied in the lab. Are you hearing me? By scientists. And in an attempt to mass produce them, some side effects were discovered because they couldn't get the structure correctly. The same thing happened with periwinkle, which was gotten from some kind of flower and some kind of plants. The same thing, morphine. Morphine is gotten from a small poppy plant that grows in Pakistan. Are you hearing me? So if plants, initially, medicines were gotten from them, and these medicines are now failing the entire world, and the same science now say, go back to the drawing board where you started before, which is herbal medicine. What is the issue of either threatening this or threatening that? It is all the same thing. It is all the same thing. And for your information, 74% of the medicine that I use today were derived from plants. And 74% of them, there are about 1,000 something that were derived from plants. 74% correlates directly with what their folklore says about those plants. Let me give you an example. In the folklore area, they say a particular plant, when you have headache, just place it on your forehead. You place it, and the headache goes away. This same plant has been manufactured into tablet now to be. We have Rocephin. We have all kinds for the treatment of Salmonella, E. coli, Staphylococcus. These are the 3 illnesses that are devastating the entire world. In the U.S., they say they are working on an old antibiotics. They are regingering it for it to be able to deal with this. Our call to the federal government is that we support the call by the new DG of NAFDAC that a commission for herbal medicine should be set up without delay. And people like us are ready to partner with government, partner with the DG NAFDAC to see that that commission comes up so that we can quickly create a Nigerian medicine from the herbal sector and quickly use it to diversify the economy of our country, and then quickly get into a place of respect in the Committee of Nations in terms of new discoveries that would come from our Nigerian herbal group that will revolutionize the use of herbal medicine in Nigeria and in the entire world. As these herbal medicines have been found to dwell and deal with issues that modern medicine today cannot deal with.
Okay, so with this recent development, relating to those people that are seen as quack, but they're actually very good, but don't have this academic qualification to boost their product?
Those are no issues. NAFDAC, before now, used to invite me as a facilitator because I am producing herbal medicine. And in my production of this herbal medicine, I sent them to the Nigerian Institute of Pharmaceutical Research, IDU, which is a well-known best practice center recognized by the World Health Organization as a center of excellence for herbal medicine. I sent it there without fear that they will poach on my product and take it over. This is the fear of the herbal practitioners, that they don't want to sell their product to where somebody will take it over. Nobody takes it over. I have 8 products registered, and all the 8 went through them. And I have not, as I sit down here, there's no single complaint that one of my products has been taken over by somebody. None. So when NAFDAC invited me as a facilitator, I was facilitating to these local people to say that, look, let's globalize the use of your product. The only way we can globalize it is to make this center to work with us so that they authenticate what we are doing. And that is the requirement worldwide. And they were listening, and a lot of them have been able to bring their products. They complain about the prices they charge them,